Hello, all, and thank you for tuning in to COVID Conversations by way of Zoom here on WNCU 90.7 FM. We're using this platform to talk about how the virus is affecting the way that we live today. My guest is Dr. Yolanda VanRiel, and she is the interim chair of the Department of Nursing at North Carolina Central University. Hello, and how are you?
I'm good. How are you doing?
I'm doing so well. I'm at home and I see that you're at work today.
I am.
Yes. And how's everything going at North Carolina Central? What's the mood there with so many people not at work?
Oh, wow. It's the mood here is kind of like you miss people. You miss the interaction.
Yes. And I guess that, it'll all turn itself around eventually. And that's why I wanted to talk to you today about the turnaround. And I wanted to talk about students coming back to campus and the measures being considered to make sure that they're safe. So first of all, talk about what you do at North Carolina Central.
Okay, so I am the interim department chair of nursing, and I work to just make sure that the nursing program is where it needs to be and preparing students to be our leaders one day.
Yes. So do you know how many nurses are in the program? How many potential nurses are in the program?
We have 48 students that are now seniors. We just graduated 40 students. We have 7 more to graduate in August, and we have 11 accelerated students, and we are currently accepting applications for our next accelerated class.
Beautiful. So what are some of the points being made when there are conversations about bringing students back to campus whenever that's going to be?
Okay, so, and also we have RN to BSN students, so we're definitely recruiting for that program. I have to get that plug. But faculty, staff, and students and administrators are quite concerned about the health and safety of the entire campus upon returning to the university. So as precautions, we have implemented screening strategies and adhering to social distancing guidelines in the classroom. And as part of our curriculum as nurses, we always have frequent hand washing. We always, we teach students to prevent the spread of contagious diseases using personal protective equipment effectively. So the importance of having ample personal protective equipment is for patients is we want to make sure we have it. So, and wearing the mask, these are things that students have always been taught. So this is actually bringing measures that we teach them into practice.
Yes. So what other best practices are going to be communicated to students?
So of course, wearing masks, social distancing. We're going to look at doing creative things with the classrooms, but the way we communicate to our nursing student is via emails, and we even have texts from course, faculty, and leadership. I am free to always available to my students. And then we also have a Blackboard site, especially for our students, and we are looking at developing social media outlets for our students too.
So how do nurses fit into the equation of healthcare during the coronavirus outbreak?
It is truly a very critical time to be a nurse because nurses are part of the frontline teams responding to the global pandemic. And this year, 2020, is Year of the Nurse and the Midwife, and the celebration of Florence Nightingale's 200th birthday. And Florence Nightingale introduced infection, disease control, and hand washing during the Crimean War. In addition, during National Nurses Week, which was just May 6th through May 12th, we were often reminded of our theme for that week, which was compassion, expertise, and trust. And during COVID-19, nurses have continued to demonstrate this theme, and they demonstrated it selflessly through values, through caring for families, communities, and individuals, and sometimes with a tremendous personal risk to themselves.
So not only are you an instructor, but you are also on the front lines in hospitals. So could you talk about that experience for us?
It's definitely a new way of doing it. And I think it's going to be a practice for a while before you come into the hospital. You get your temperature check. Of course, you wear your mask. You wear your mask when you're out in the hallway. I'm a patient placement coordinator, and some people will notice as a nursing supervisor. So the only time my mask is off is when I'm in my office by myself. But when I'm out making rounds, you have mask on, and everyone's adapting well to it. I don't know if you've seen it, but now, there's the masks are fashionable. They're wearing different kinds of masks. And they are doing what they've always done and take care of patients, and everybody in the hospital. It's like that right now. We still have visitor restrictions, and so, which can be hard. So we're making sure that the families know what's going on with their family members.
So after someone has been noted to have the coronavirus, then how are they treated in the hospital? Is it segregation? What do you do to help contain the spread?
So there is COVID unit. There is one floor that takes care of the COVID patients. And these nurses do not take care right now with those COVID patients. I just worked recently, and the floor has nothing but COVID patients on it. So they keep them on one floor, and then there's one dedicated ICU unit for these patients.
Okay. So when you're there, what is the mood? Are relatives not allowed to see patients with COVID still? How do you handle being able to assure the patients that they're in good care without having family members around?
Well, we do what we nurses do. We always are informing family members. We keep them updated. The ones who can, that can talk with their family members, of course, they talk with them, but we're doing everything we can to make sure that they have some contact with their family members.
Okay. How, in your opinion, will the coronavirus change the future of nursing education?
Well, nursing education has been impacted dramatically by COVID-19 pandemic, especially with the rapid transition to remote learning and the sudden need to adhere to social distance guidelines. Some class sizes are going to be reduced. Many classes can be conducted remotely. And in addition, with the uncertainty of clinical rotations in healthcare facilities amid the COVID-19 pandemic, there's a need to prepare faculty for the transition to clinical experiences virtually using technology such as virtual SIMs, virtual pre and post conferences such as Zoom, which we're using, and WebEx. And traditional teaching strategies are being moved into a new normal with dependence on technology as an expectation. And then clinical rotations for students will certainly be different as we increase awareness of infection control becomes front and center of the healthcare experience.
So what is a virtual sim?
So virtual simulation is, so if we can't go to the clinical rotation area, virtual sims will take the place of going into those areas where they can actually take care of a patient in virtual sim, and you would be able to do like as if you was treating a patient, communicate, do interventions, and then you will get a response back. Okay, this is correct, or what else are you missing? We have been doing virtual sims with students. We've also have brought students on campus, making sure we do COVID screenings, wear their masks, wear their gloves, and we actually have some of them, they have one person doing in the sim room and the others in the classroom. So we've been doing creative things.
Yeah, that kind of segues into my next question of you talking about the pandemic as a learning platform for new nurses.
So COVID-19 pandemic is an opportunity for new nurses to use the nursing skills that they were taught in school, which includes personal protective equipment. Nurses have always used personal protective equipment, and especially in acute care settings. So students are actually saying, wow, this is more important than ever. And of course, and you've probably seen it on the news too, that the importance of using personal protective equipment is to make sure patients, the public, and nurses are protected, avoiding the risk of infection. And it's also been an opportunity for our students to provide compassionate care for patients, their families, and the public. So, and our new nurses, our new graduates are the first to have this experience with a pandemic. And so many of them have families and have had to complete their education while educating their own children at home, determining how to balance the disruption in their schedules.
Absolutely. The next question is, what would you tell anyone planning to become a nurse at this time? I'm sure that decision-making could make them a little bit anxious with the pandemic that's going on now.
So I would tell anyone planning to become a nurse about the positive impact we make in the lives of others on a local level and around the world. I would encourage them to strengthen their skills in science and math because they are the foundation for being successful in nursing education. COVID-19 has shown us how valuable nurses are now, and will continue to be in the future. And at North Carolina Central University, the Department of Nursing is preparing our graduates, our nursing students, for excellent clinical practice in the current and emerging healthcare environments. We are preparing our graduates to care and be mindful about the health of families, the elders, local communities, and create positive change in the environment for a healthy life.
Okay, we are just about out of time. Is there anything else that you'd like to add, maybe that I didn't ask about?
I would just say that, North Carolina Central University Department of Nursing has a 70+ year legacy of training and preparing nurses who serve the health needs of the people in North Carolina, across the nation, and around the world.
Okay. Dr. Yolanda VanRiel, it's been my good pleasure to speak with you today.
Thank you. Thank you for interviewing me. It's been my pleasure.
You're welcome very much, and stay safe, okay?
All right. Thank you.